Hello everyone, my name is Marleen Kok from the Netherlands Cancer Institute, NKI in Amsterdam, the Netherlands. Unfortunately, I cannot be present in San Antonio today, but it's a true pleasure to present to you today an educational lecture on optimizing breast cancer immune therapy using biomarkers. And the topic of today will be the advances in single cell analysis as well as in spatial technologies. To be more specific, what I will discuss first, I will show you what we know about biomarkers in immune therapy in breast cancer, or especially what we don't know. A short introduction on technologies, so single cell analysis technologies and spatial analysis technologies. And then a snapshot on what we know about data that come from other tumor types that have used single cell analysis to better understand the tumor microenvironment. And then the last part of my talk will be about single cell data in breast cancer, spatial data in breast cancer. And for both categories, I will have a bit of data on breast cancer immune therapy and single cell analysis. So first, what do we know about biomarkers in immune therapy? We don't know much, actually, although more and more studies have revealed data of things that could be important. But as you might know, as of today, we are basically only using an immunohistochemistry assay to measure PD-L1 on tumor cells as well as on immune cells. So that's based on the indication of pembrolizumab plus chemotherapy for PD-L1 positive metastatic triple negative breast cancer patients. We've also seen data of PD-L1 when studied on immune cells. On the genomic level in TNBC, MSI status has been linked to outcome on immune therapy. Tumor mutational burden has been linked to outcome on immune therapy. And here, TILs, so using an H&E level of immune infiltrate is positively correlated with outcome on immune therapy. And also several immune signatures have been presented that might predict the benefit of immunotherapy in triple negative breast cancer patients. All those technologies have focused on bulk analysis of the tumor, and that's depicted here as approach B. So the RNA is taken from all cells, and you basically look at an average of expression. But you can envision that if there is a rare cell population, which is very relevant, you miss the signal. While in this talk, I will focus on single cell analysis. So gene expression in a single cell or in a small subpopulation of cell having the same characteristics. There are different technologies. Here is a list, not comprehensive, but I think most frequently used, of technologies that can be used to study cancer in a single cell manner. So single cell RNA sequencing, it's most frequently used using 10x technology, InDrop, SmartSeq. Also of interest for outcome on immune therapy is the TCR repertoire sequencing that can be done on a single cell using RNA of DNA coming from that T cell. SiteSeq, in which you combine the transcriptome of a cell that has a certain epitope. Flow cytometry seems a bit old-fashioned, but I think a very important technology to study proteins on a single cell. CyTOF, a bit more trendy technology, also measuring proteins in a single cell. Exome sequencing on a single cell, as well as ATAC sequencing, in which you can study the epigenome of a single cell. What kind of spatial technologies are currently being used? Of course, you can use immunohistochemistry and simply use different markers on different slides and combine it. That can also be done with immunofluorescence, in which you can use different antibodies on one slide. Tissue CyTOF, so the CyTOF technology, but then on a slide, measuring proteins in a single cell. Codex, that's making use of oligonucleotides. MIBI, I will show you a bit more on the MIBI technology in a bit, which is using ion beam technology to study protein expression in single cells. In situ hybridization can be used to study RNAs and DNAs in a single cell. That's what we also do for HER2 amplification in the current diagnostics. More and more you see barcoding technologies popping up in literature to assess the spatial information in the cancer and the tumor microenvironment. And also more and more papers are now being published on DSP, so digital spatial profiling. Some technologies I will discuss a bit more in detail. So this is the basis behind single-cell RNA sequencing. So single cells are linked to a barcode using an emulsion with oil. So there is a droplet. In this droplet, the DNA or RNA is barcoded. And then if you then sequence and you know what barcode is related to a single cell, you can relate certain sequences to a specific cell population that has the same barcode. Tissue site-off. So tissue site-off single cell, but it's also spatial because it's done on a slide, as an example is shown here. So here you see if it's used using mass cytometry or when it's used using ion beams. So in both situations, that you have conjugated antibodies of a panel of around 40 or 35 markers. In this case, a laser technology is used to analyze where does the antibody bind. In this case, an ion beam is used with secondary ions. And then using mass cytometry, you know what kind of proteins are labeled. It's not that you get immediately this picture, but for the 40 markers, an image is constructed and it's combined, and that's how you end up with such a very elegant picture. Spatial transcriptomics, so looking at the transcriptome in relation to the proximity to other cancer cells. In this case, DSP, it's using antibodies as well as oligo probes, RNA probes. A researcher or a pathologist selects a region of interest that depends on your research question. And within this region of interest, it is studied what kind of antibodies are binding and what are the RNA oligos that are linked to that region. And of course, you can study multiple regions, but it's a very interesting technology using protein plus RNA levels, but it's not always easy to bring it back to really a single cell level. Let's have a look at what we know about what single cell studies have yielded in other cancer types where immunotherapy is more used and also more studied. This is an interesting overview presented in JXMed. It's a wrap-up of the data from single cell studies, and I present here to you some red dots, and those are of interest because I think they're now also popping up in the breast cancer immunotherapy literature. Apologies. So here you see, for example, that within the cytotoxic CD8 T cell population, the tissue resident memory like T cells seem to be very important when you want to select patients that have more response to immune checkpoint blockade. And also studies have pinpointed towards a population of dysfunctional CD8 T cells that are more clonal. In the macrophage studies, it's more and more becoming apparent that the macrophages expressing CXCL9 or 10 can lead to increased recruitment of T cells, which is of course important for T cell based therapies. Two other papers that I can highly recommend that focus more on T cell biology. In this paper, it presents what kind of characteristics have been revealed using single cell sequencing. So CD8 T cells that have a memory-like phenotype seem to be more abundant in responders compared to exhausted T cell in non-responders. However, it's important to really realize what kind of definition and population is used when you use exhaustion as a definition. Exhaustion is also sometimes replaced by dysfunctional T cells. And this review explains exactly what the difference is and that there are different states of exhaustion, different states of dysfunctionality. For the CD4 population, it seems to be very important what kinds of CD4s are present. Do you have more Th1-like cells, then you're more likely to end up as a responding tumor in contrast to the Th17 positive cells. And not only the phenotype, but also the cell state matters. So it's also important whether cells are indeed cytotoxic. So that is a wrap up of the technologies and the data that have come out in other cancer types. So let's focus on, let's go to the breast cancer research field. So this is a complicated table presenting, I think, key examples of papers presenting single cell data. Maybe your favorite paper is missing because it's not a total overview. Here you see that 4 years ago, one of the first papers came out simply describing that there is heterogeneity if you look at single cell level. The group of Shireen Loy has presented, I think, an elegant paper of single cell sequencing of the CD3 positive cells in the tumor microenvironment, presenting that there are at least 3 clusters of CD8 positive cells. And again, also hinted in the pan-cancer setting that tissue resident T cells seem to be important, especially because they have high levels of PD-1. Another group presents, for example, single cell data on the fibroblasts in the cancer cell. In 2018, a very interesting paper came out on single cell data of CD45 positive cells, including TCRs on a single cell level. And it describes that it really matters what kind of cell state the expanded population has. So are you looking at activated T cells, differentiated T cells, effector versus memory, etc. I can highly recommend reading this paper by Kim and colleagues, where they performed single cell RNA sequencing and DNA sequencing during chemotherapy, so during neoadjuvant chemotherapy. And they described that on the DNA level, that the resistant clones seem to be pre-existing, while on the RNA level, that the transcriptional programs related to resistance are more acquired. All that information coming from single cell study. So the Bodemiller group, a larger data set of 144 tumors with CyTOF, presented that PD-L1 is presented on macrophages in the breast tumor microenvironment. And now you see more and more papers focus on specific cell populations. For example, this paper on single cell data on B cells and the B cell receptor repertoire. So let's focus on the single cell data in the space of immune therapy in breast cancer. Only a few studies. This is, I think, the first study, the BioKey study coming from the Leuven group, analyzed by the lab of Dieter Lambrechts. So close to 30 patients were treated neoadjuvant with 1 cycle of pembro, and then they went to surgery. So if you give 1 cycle, it's very difficult to, of course, determine the clinical response. But what the authors did, so they considered a tumor responding when they saw an expansion of clonal T cells. So it's around 1/3 of the patients showing expansion of clonal T cells. And those tumors here in red have more T cells at baseline, not surprisingly, but less fibroblasts. Interesting finding. Also coming from this paper, it does matter what the level of PD-L1 is on exhausted CD4s and exhausted CD8s. Then zooming in on more single gene and cell phenotypes. So they described that in those patients where they see an expansion of clonal T cells, that cytotoxic T cells expanded, exhausted T cell, also expansion of CD4 cells were seen, especially the Th1 cells. And it was all related to PD-L1 expression on dendritic cells at baseline, and inversely correlated with T cells that had a pre-effector state. So there you saw less levels of clonal expansion. So the second study, analyzing material coming from patients that were treated with immunotherapy, in this case, metastatic triple-negative breast cancer, treated with chemo or chemoimmune therapy. So what they described, especially on treatment, I think is very important. So if you treat with atezo plus chemotherapy, they observed an expansion of dendritic cells, CD8 cells expressing CXCL13, CD4s with similar phenotype, and follicular B cells. While only if you treat with chemotherapy, different changes were observed, where even those critical important populations went down and the suppressive macrophages went up. So this is just a small study, but I think it provides important hints to get better understanding of what immune therapy, chemoimmune therapy is doing to triple negative tumors. Let's zoom in on what we know about spatial analysis in breast cancer. Again, a large table. It's not even complete, but just some key examples as an inventory of what we know about spatial analysis in breast cancer. Of course, first papers were proof of concept with the MIBI tissue CyTOF technologies. And then from the same group, so the Stanford lab, the MIBI technology was tested on triple negative breast cancer, showing that PD-L1 was expressed on CD4s, macrophages, PD-1 on CD4 as well as CD8 T cells, and that PD-L1 is also seen on monocytes. Another approach was taken by the Moret Park lab, presented by Tina Russoway. So they took different CD8 phenotypes and performed microdissection and constructed gene profiles from those small pieces in the tumor. And not surprisingly, they found that in the inflamed tumors, there were more cytotoxic T cell expressing enzyme B, while in the immune cold tumor, they found more fibrotic stroma. Also an important paper to highlight, so the first large paper on using tissue cytof, coming from the Bodemiller group with 35 markers, a very data-rich landmark paper. And I would also like to highlight a recent paper using the digital spatial profiling coming from the lab of Christine Curtis. And they saw that the changes induced by only one cycle of anti-HER2 treatment were predicted of a PCR. So that's one of the first key papers on DSP. So what do we know about spatial analysis and immune therapy in metastatic triple negative breast cancer? So I will show you two papers where only one marker is used with the spatial analysis. So spatial information on CD8 with the well-known phenotypes inflamed, excluded, and desert tumors. These data have been presented by Licia Emmons last ASCO, showing that when there is an inflamed tumor, so that the T cells are really in the tumor, those tumors are more likely to benefit from the addition of atezo. To a lesser extent, excluded tumors, but there seems to be no benefit of immune therapy in desert tumors. We confirmed more or less this finding with a different approach. So again, those CD8 phenotypes, but we constructed a gene profile related to these phenotypes, simply because in a lot of data sets, there's no slides available. And also, if you want to go to online available data sets, a gene expression signature can be used. And as expected, a gene signature related to the inflamed phenotype was more prominent in responding tumors. So this is from the TONIC data set where patients were treated with nivolumab upon metastatic disease. And in the patients that showed progressive disease on nivolumab, way more tumors had an immune ignored or excluded phenotype. Then I would like to highlight two papers that combine single cell analysis with spatial information. So this is a Nature Genetic publication coming from the group of Charles Peru. It seems to be a very straightforward, simple experiment, but I think it's important. So they take breast tumors classified using bulk data, and then they performed single cell analysis to see in a single cell what the intrinsic molecular subtype classification was. And here you see for the luminal A types in dark blue, that some were indeed 100% of the cells were luminal A, while in this tumor, the majority of the cells, in contrast to the bulk classification, had a luminal B phenotype. The tumors seem to be a bit more homogeneous in the luminal B and the HER2 group, while in the basal group, for example, this tumor, the majority of the cells actually had a HER2 enriched phenotype. So important experiment. Another experiment presented in this paper is using CytSec. So what you do with CytSec, you take cells with a certain epitope, usually an antibody, and you look at the transcriptome. And here they present even 5 CD8 clusters. So you see 1, 2, 3, 4, 5. And this illustrates that it's kind of arbitrary how many CD8 clusters you call, whether it's 3, 2, or even 5 as suggested in this paper. What's also interesting in this paper is the spatial analysis. Here you see 3 pieces of tumor coming from different patients. And here you see the spatial transcriptomics of this piece and this piece and how it can differ. So the level of CXCL10 positive macrophages. So these macrophages can attract T cells, basically. You see a lot of differences, and also that it matters where in the tumor they are located. Intriguingly, in this paper, they also present the spatial proximity of certain cell types. In this case, the spatial information towards a fibroblast population. So if there is a yellow, it's a high score, meaning these subcells are closely to a fibroblast population, while if the score is low, the cells are far away from the fibroblasts. Last but not least, single cell plus spatial information coming from the NeoTrip data, presented here at this meeting at San Antonio. And thanks, Gianpaolo, for sharing the slides in advance. They use tissue cytoff to characterize tumors benefiting from chemo plus atezo or chemo only. And here you see markers in the tumor microenvironment, so characteristics of the immune cells, basically. And if you see a red dot, it's the odds ratio for tumors treated with chemo immunotherapy, and in gray, the tumors with chemotherapy only, so the control. And if the p-value is significant, it means that the marker is related to the immunotherapy benefit. And strikingly, here they show that the Ki-67 in the immune cells seem to matter, so the amount of proliferation in the tumor microenvironment. Next, they presented data on cell phenotypes. And we all know that PD-L1 at least provides a hint towards which tumors could benefit, but it seems to matter where PD-L1 is located. So here they present that PD-L1 on antigen-presenting cells that are also IDO1 positive, so a marker of suppression, seem to matter when you want to predict the likelihood of that addition of immunotherapy helps. And I really like this analysis, so an interaction. So if you have a high score, meaning the cell population is close to the tumor cells, and here they show that it does matter how close the B cells are close in relation to your tumor cells, the plasma cells, and of course the different CD8 T cell population. That brings me to the conclusion on single cell and spatial analysis. So in general, I think studies on single cell and to a lesser extent spatial analysis are really emerging. There are many open questions on, for example, reproducibility. So how many CD8 T cell clusters should we define in a certain tumor? And are there more CD8 T cell clusters in melanoma versus breast cancer, for example? I think we can consider this a very interesting and useful discovery tool, but it's still not suitable for large series. I think this review presents, I think, a very smart approach. So in the discovery phase, where you have relatively few patients with complex technology, and you take several samples also on treatments, you perform single cell analysis, but in parallel, you perform bulk analysis. So you can link certain data that you get from the single cell information, you can link it to less complex technology, and those more simple technologies can be used in larger data sets where you, for example, have only a baseline sample, and this will be more applicable for clinical practice. And then the conclusions on single cell and spatial analysis in breast cancer immunotherapy. I think it's very early days with only 5 studies, of which 2 only use the CD8 phenotypes. But I have to say that there are certain hints that can be found back in different studies. For example, the role of PD-1 positive CD8 exhausted T cells. Cytotoxic T cells seem to be important for immunotherapy response. CD8s that express CXCL13 and the PD-1s on dendritic cells seem to be very important. Last but not least, spatial information. So there are now 2 studies in a metastatic TNBC setting suggesting that it does matter where the CD8s are located, and that the CD8 inflamed tumors seem to benefit way more from immunotherapy. And last but not least, from the NeoTrip data, that it seems to be important that the B cells, plasma cells, CD8 positive, PD-1 positive cells, that they are close to the cancer cells to really do the job and get an effective anti-cancer immune response. I would like to thank colleagues and friends that sent me during the pandemic inspiring information on single cell data, for example, this cartoon. Special thanks to people from our lab, Iris Nederlof and Olga Iseva, who helped with preparation of this talk, and also my colleagues and friends that provide input, Gianpaolo Bianchini, Kevin Puni, and Mike Angelo from Stanford. Enjoy San Antonio.